Hello, ladies and gentlemen. It's Adel Hanbali with you again, and today I'm going to present you another case, a case called New Protocol: How Drug Rebirth as Cancer Treatment Fueled Price Rises. I'm doing this presentation as part of the Ethical, Legal, and Social Values of Business course that I am taking, part of the MBA program I am pursuing. So, what is the case about? The case is about a drug called Salomid, which price has been increasing exponentially after the discovery of the potential use of the drug as a treatment for cancer. So how did the story begin? It began with Celgene, who owns this Salomid drug and got FDA approval for the drug in 1998 after it developed a very strict distribution system for the drug that prevented pregnant women to reach the drug, because the drug before Celgene never got FDA approval because it caused very horrific birth defect for pregnant women that take the drug for morning sickness. But only after Celgene could develop a very strict distribution system, they got the FDA approval for the drug. We have to keep in mind that the drug was also prescribed for off-labelly prescribed for AIDS patients because it helped them in their wasting. What does it mean? It means that the drug was officially a drug for leprosy. However, some doctors prescribe it for AIDS patients. They got FDA approval in 1998. So the question was, how much would they charge for the drug, knowing that it will be off-labelly prescribed for AIDS patients? They started the pricing as $6 for this 50 milligram pill. And just after they launched their product, some researchers found out that this same drug could be prescribed for cancer patients. And at this point, Celgene realized that the drug will be again off-labelly prescribed for cancer patients, and so it can charge the patient way higher costs because it is now for a disease which the sky is the limit, as they describe it. They started increasing the price year after year until they reached in 2004 the same 50 milligram pill that were charged for $6 in 1998. It is in 2004, it cost the patient $29. This is an increase of 384% in 6 years. Now, this increase in price was not being pleasing by the public, and even some insurance company were considering cutting the reimbursement for the patient taking this drug. So what do I think about the case? To tell you what I think about the case, I have to first introduce you to the point of views of John Locke in his article, The Justification of Private Property. John Locke affirms the right of private property as a natural right, a right that should be protected and respected by the government. What is it? What is the right of private property? For John Locke, once you exercise labor on a certain resource, it becomes your property on a condition that the resource was owned by all mankind. There is a famous example on apples. When you exercise labor on the apple, when you grow these apples, they become your own property because you exercise the labor on them. So back to the case, if we take John Locke's standpoint, the drug Salomid is a private property of Celgene because Celgene was the one that developed the drug, did research on the drug, got FDA approval on the drug, so it is a private property of Celgene. Now, if we go back to John Locke also say when you own something that is your property. You are free to do whatever you want with it. You can trade it or take full advantage to it. In Seljan's case, they are taking full advantage of it by charging very high prices for the patients and making very high profits. From my own point of view, I think that this would be ethically incorrect because it is directly related to people's health. And for me, human health should be or is the most basic human right. Even the Declaration of the Human Rights clearly mentions in its Article 25, everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, including food, clothing, housing, and medical care necessary social services. So here again, I stress that because this product or this property is directly related to people's health, they cannot take full advantage of it by charging patients very high prices, especially that those patients are cancer patients, meaning that they are very hopeless patients that would pay any amount, literally any amount, to try to beat this disease. So Seljan is taking advantage of the hopeless patient to make big profits. Now, moving to another point of view, if I was okay that Seljan charges high prices and make a lot of profit out of the patient, knowing that the cost of production of the drug is very, very, very low. So it's making huge amount of profit. How it is spending its money or its wealth? How is Seljan spending its money? The article says that Seljan is spending the money to fill the pockets of its executive and fund its research and development department to come up with new medicines that would be used for the same purposes of making a lot more profit. Now here there is another article called Wealth by Andrew Cartage, and in his article Andrew Cartage proposes a way to try to diminish the gap of wealth or the wealth inequality. He says that the surplus wealth of the very wealthy people should be given to those people that want to help themselves, that want to improve. In Seljan's case, it is using its surplus wealth for only its own interests. So on both points, Seljan is not acting ethically correct because it's taking advantage of the patient, but also it is spending its money in a non-ethical, responsible way as per Andrew Cartage's point of view. So I guess that's it. Thank you for taking your time listening to my presentation, and I will see you in the next presentation.